aimed high because that's what best benefited our patients. Having their physicians know about their visit at our hospital is a win for the patient because their physician's more included in that care scenario. The wins for us is that moving into stage 3, we're already well under our way to meeting whatever those requirements are going to be. I mean, we have very little fear moving forward. We don't have to scramble. We don't have to rethink another solution to meet another minimum requirement. The workflows we have in place work. They're not any extra work for any of our nurses or any of our physicians. And then on top of that, it's enough data to enough people in a meaningful enough way that they're using it. They're using the transition of care documents to populate their systems or to view it in the inboxes we provided for them. For the particular value that we're talking about, it's the transition of care. And as the requirement reads, you have to send 10% electronically with an additional 40% paper or electronic. So for a 50% total, the hard to accomplish task is that 10% electronic because it requires you to have a recipient who can receive it as well as the ability to send it yourself. We attested in July of this year, 2014, with 57% purely electronic. We're not having to do any paper processes. That is actually a slightly downgraded number because we acquired another facility that has almost no electronic process. And so our number for our facility alone is closer to 70 or 80% so that we can sort of absorb their not as great infrastructure. Corepoint gave us the flexibility to really get to the workflow that worked best with our organization. Like I said previously, we didn't have to change anything for our nurses. Because of Corepoint, we were able to basically do it all on the back end. It is transparent to our users that we're meeting the standard, and even to our doctor's offices. They get their transition of care document, and they didn't have to change anything. It's a lot easier to report on, it's a lot easier to track, it is easier to troubleshoot, and then from a clinical point of view, electronically transferring these documents, it's not something the physicians were receiving before. They did not know about emergency room patients from a pediatric clinic point of view. Now, the pediatric clinic knows about all of their patients that come to the ER, whether the parents remember to tell them or not. If they have a follow-up appointment, the pediatrician is informed and they know what's happening with their patient, which gives them the ability to reach out and be more involved in that patient's care, make sure that their patients are doing what they need to do or being taken care of properly. The testing tool is amazing. I really do enjoy being able to test within the engine easily. That's not something we had in our previous interface engine. That may actually be the best part of developing in Corepoint for me, is that I can make changes, I can test them even in production if I need to without affecting anything until I'm ready for it to be in place. I was unprepared for how good Corepoint's customer service was. We haven't had to call them a lot. We haven't had a lot of problems with Corepoint. We've used them mostly to hold our hands during Windows patches or Corepoint upgrades, and they've been 100% willing to schedule at crazy hours. You know, because we're a hospital, we can't close at lunch to do an interface engine upgrade. So 4 o'clock in the morning, 5 o'clock in the morning, there's always a support rep prompt and on the time calling us. I mean, you know, beating me to work several times, you know, ready to do the patch, ready to assist with the upgrade.